America is often called a land of immigrants, but a new White House proposal to make it more difficult for those who rely on public benefits to stay here is having a chilling effect nationwide.
It's really a mean-spirited and harsh policy change.
I'm telling our patients, I want you to come in to see us.
It's time to begin moving toward a merit-based immigration system.
The new policy would, for the first time, weigh the use of benefits like Medicaid, food stamps, and housing vouchers negatively when deciding whether to grant U.S. permanent residency or citizenship.
Our biggest fear is actually having him be deported.
How would the public charge rule change affect our local community?
To hear people talking about us as burdens is just unconscionable.
Our studio panel weighs in.
This leaves a lot of discretion at the hands of immigration officials.
It massively widens the net of who we're saying we're going to shut out.
A confrontation on immigration, next on City Inside Out. Welcome to City Inside Out. I'm your host, Brian Callanan. A new federal proposal to crack down on legal immigrants who are dependent on the government to meet their basic needs has caused a firestorm of debate. It's a new interpretation of our country's public charge rule, and it means that the use of services for housing, food, or medical care could count against people applying for permanent residency in the U.S. The Department of Homeland Security says it's trying to protect American taxpayers, but advocates say this is a misguided approach to immigration that would negatively impact all of us.
Our goal was to have him apply for a green card.
Alicia Ramirez has a husband from Mexico.
I want our family to be together.
Mr. and Mrs. O, not their real names, are green card holders trying to bring their adult son here from China. These immigrant stories are seemingly worlds apart, but they share a common emotion right now. They're very afraid.
Our biggest fear is actually having him be deported.
We're worried about whether we can continue to live here in America.
The source of that fear is a proposed rule change from the Trump administration.
It's time to begin moving toward a merit-based immigration system.
The Department of Homeland Security wants to update a century-old policy called public charge, which says immigrants must show they can support themselves financially before they're allowed into the U.S. In the past, immigrants who receive cash welfare payments have had that weigh against them. But the new proposal says use of almost any public benefit, from food stamps to housing assistance to medical care, could count against families too.
Now you have a president who is standing up for America.
Alicia is a U.S. citizen and mom of a 5-year-old, with a husband here legally as a so-called dreamer. She says, out of fear that his sensitive legal status may be jeopardized, they don't use public assistance.
We still struggle.
But to be all but blocked from those benefits in the future, especially with a husband who's building up his own auto refinishing business, fills her with frustration and anger.
It almost feels like we're doing things the right way, the way that they tell you you're supposed to, and we're still getting punished for it.
With this couple, Mrs. O has a part-time job as a home care worker, and she's considered pulling back from using benefits too.
Because of our older age, maybe the U.S. government will see us as an increased burden because we're now living in low-income, subsidized senior housing using Medicare.
Rest your arm here.
That fear of using services, especially health care, is a problem for all of us, says Dr. Rayburn Lewis.
The impact I see in this community is saddening.
Dr. Lewis is Chief Medical Officer of International Community Health Services, a 9-clinic system that cares for 30,000 low-income, underinsured patients across King County.
Did you take your medication today?
Experts say the public charge proposal, if it passes, would not apply to benefits used before the rule is put in place, a process which would take several months.
You try it? Do you eat it?
But ICHS saw a 10% drop in diabetes care visits soon after the public charge story hit the media. And there's a concern child immunizations may start falling off too. Lewis says when patients skip preventive care visits, they're more likely to spread diseases and more likely to affect the public's pocketbook with a trip to the emergency room for care.
The effect of public charge is to potentially drive those costs up because patients will engage us in the most expensive part of their illness, that is, the acute care phase.
At the Cherry Street Food Bank on Seattle's First Hill, they're bracing for impact too.
We don't want anybody to ever feel scared or intimidated about asking for food.
Christina Wong is Director of Public Policy and Advocacy for Northwest Harvest, which serves more than 5,000 people here at the Cherry Street Food Bank each week.
Thank you, thank you.
Northwest Harvest does not take public funds for its work, which means it doesn't have to record identifying information about its clients. But that client base might swell if more people shy away from using government services like food stamps.
We have created an intentionally low barrier to services.
Above all, she's concerned that immigrants in poverty will be forced to decide between having something to eat or having somewhere to live.
Many immigrant families have felt that they have little choice between, do I use the services for which I'm legally authorized to use and that I need in order to keep my family healthy, or do I forego that because I'm worried that maybe my family won't be able to stay together?
It's a sentiment literally echoing around the world by these immigrants from China and the wife of an immigrant from Mexico. If you were able to talk to President Trump right now, what would you say?
We're already here legally, but we're afraid if we leave the U.S., we won't be able to come back in because we're using government benefits.
It's not just my family that's hurting, it's the entire community that's hurting with us.
As we begin, let me offer a special thanks to a number of groups here, including CISC, One America, ICHS, ACRS, and a number of other groups who have helped us put this important show together. I'm going to introduce our guests right now on our panel. Teresita Batayola is here. She is CEO of ICHS, the International Community Health Services. Teresita, good to have you.
Thank you for having me.
We also have Jorge Barron. He is Executive Director of the Northwest Immigrant Rights Project. Jorge, good to have you too.
Thank you.
And we also have Ingrid Ulrich. She is Policy Director for Public Health, Seattle and King County. Ingrid, good to have you too.
Thank you.
So here we go. Teresita, I'll start with you. The Department of Homeland Security says it's trying to protect public resources and taxpayers here with this proposed public charge rule change. But it appears there's already an impact before the rule has even taken effect on immigrants locally. And I want to start with the people you work with in connection with this issue. What's happening with them right now? What are your concerns?
So first of all, let me say that studies have shown that immigrants pay far more in taxes than they ever use public benefits. And a recent study by the insurance industry also showed that immigrants are really buying a lot of insurance, far, far more than they ever need or use. So, you know, I wanted to get that right off the bat in terms of immigrants being a burden on the system. But unfortunately, as far back as last year, we started to see the impact of this proposed public charge because there were leaks last year that were far broader in terms of what it would cover. So the leaks included anyone using Head Start, Women, Infant, and Children's Programs, or WIC, or the fact that children who are born here, who are U.S. citizens, if they access any public services, that those would affect the status of their parents.
Right.
So even last year, we already started seeing the chilling effect of people being afraid to access those services. So when this was released, then we started to see the uptick again of people calling us and asking to get disenrolled from programs, even programs that were not listed under the new public charge definition proposed.
Right, and we're going to break down some of those details. Thank you for bringing that up. Jorge, I want to bring you in here and realizing that every single case of an immigrant is different, but I'm going to try to break it down this way. If I'm an immigrant, worried about my status, what are my rights with these proposed changes coming to the public charge rule? Does this apply to all immigrants? It's a complicated picture here. Help us paint it, please.
Yeah, and unfortunately, I wish they could be kind of more clear because I think part of the problem right now is that there's been already some changes made by the administration for people who are applying for green cards or for lawful permanent residence outside the U.S. So some of those changes have already been implemented, and frankly, they don't really match up exactly with what what the proposal has been for the people who would be applying inside the U.S. And so we're learning as we go in some ways for people who are going through this process outside the U.S. or who are having to leave the United States to be able to get their green cards at a consulate or embassy outside the U.S. And we're starting to see how it's going to be applied. And in some ways, one of the concerns that I have is that, this leaves a lot of discretion at the hands of immigration officials. And so there's all these like multi-factor tests and totality of circumstances. And so I think one of the challenges for many of us is that, both for the changes that have already been implemented abroad and the changes that have been proposed, there's a lot of lack of clarity of exactly how it's going to play out. Yeah. And so I think one of the things that we're advising people is just to make sure that they talk to an immigration attorney or to a recognized accredited representative who can provide legal advice about their individual situation. Right. And for people not to make sort of rash decisions like we heard earlier, people dropping benefits because of the fear that it might affect them when a lot of these changes have not gone into effect yet.
Very good point. Ingrid, I want to go back to this issue. Concerns over public charge have prompted some of these immigrant families to stop using health services that they're legally entitled to. Tell us what you're seeing in the King County area and talk about how people skipping out on medical care can really affect everyone, not just immigrants, too.
Absolutely. So this fear and confusion that you're hearing us describe is truly real. It's something that researchers have actually documented during the wave of welfare reform in the mid-90s. We saw that immigrants who were not impacted by those rule changes were dropping benefits. We have documented that. It's also actually predicted in the rule put out by the federal government. They predict that there will be a large number of people who will drop benefits, and significant savings of government funds are predicted in the rule itself. So we know this will happen. And here in King County, we've run some estimates. We know it's a large number of people that will feel this fear and confusion. And we predict that more than 220,000 families or individuals will feel this impact. And that includes individuals who live in families with two criteria. One is they have a family member who is a non-citizen immigrant in their family, and the other is that they're in a family or at least one family member receives either Medicaid or SNAP, which is basic food assistance.
Right.
The families who meet one of those two criteria are likely to feel very nervous in this climate and are at risk of dropping or foregoing benefits. So that's deeply concerning. Right. If they do forego those benefits, we see a number of negative impacts which can lead to hunger, disease, and ill health.
Right, for all our community here. That's a very important point. Jorge, I want to go back to you and really try to put this in perspective. Leading up to the midterm elections, we heard a lot of focus on illegal immigration, this caravan that was heading towards the U.S. For the past week now. We haven't heard a lot about it, as it so happens, but this is different. We're talking about legal immigrants, and the implication from the feds is the system for immigration is getting abused in some way. This rule change will fix that, promote self-sufficiency. Do you agree? Do we have a broken system?
Well, I think we have a broken system in some ways, but not in this way. I think the problem is that we are trying to, I think that what the administration is really trying to do is to circumvent Congress, right? I mean, the president has made it very clear that he wants to change the immigration system to go to a so-called merit system and to actually reduce the numbers of legal immigrants that are allowed into the United States. He hasn't been able to do that through legislative action, so he's using the administrative rules to try to reduce immigration in other ways. And so this is just simply putting, it's a multi-pronged approach, I would say, of putting obstacles in the way of people who would qualify, who our Congress has said should be entitled to be able to get green cards. And so he's putting these rules in place that are going to dramatically reduce the number of people who could benefit from a green card, who have family members who qualify that way. And that's what should be concerning to all of us, because it's contrary to what we have said in our laws. But on top of that, it's also going to create all the impacts that we've been discussing for the broader community.
And Teresita, specifically, we've seen cases where immigrants are not only disenrolling from programs, but also calling agencies and asking to have their records expunged so they don't have a past record of benefits coming in either. I don't believe that past usage is supposed to count against you with regard to this. Can you help clarify this? What are you telling your clients about this?
So first of all, we're saying to them, if you qualify for benefits, use them now. The change is not in effect. Now is the time to really get the care you need so that you can remain healthy. But I started to talk about what happened last year with all the different leaks. Well, the leaks also included a look-back period. 3 years was frequently mentioned. And so people started stopping their care and asking for their records to be cleared, because if there's a 3-year look-back period, they don't want documentation that, in fact, they have been using public services. And as I understand it, though, and maybe Jorge can help me a little bit, there's still a look-back period in this one, that 60 days after the rule is actually adopted, it does go back to 36 months. If people have been using Medicaid, if they've been using Medicare Part D, if they've been using food stamps, if they've been using Section 8 public housing or public housing benefits through Section 8. So
I know we're getting into the weeds a little bit here, but it's important. Yeah.
Well, it is important because even though those programs have been named, people are thinking any and all government programs.
Yeah.
And that is an even bigger impact in terms of people's risk.
Yeah. And Jorge, maybe I can bring in here, because I think another scrutinized part of this proposal is this income test, which says if you're making 250% of the poverty line or above, that will be viewed favorably. So that's $41,000 for 2 people, about $63,000 for a family of 4. In terms of the immigrants we have in our region, do you have an awareness who's meeting that threshold, who's not? It just seems like a big number to meet potentially.
Well, absolutely, and I mean, I think there's a lot of aspects of this proposal that are deeply problematic, because as I mentioned earlier, this is setting like new rules basically about who gets status, and we don't really have that in the law. The law is providing that if you have a family member, you have the opportunity to petition for that relative to get green card status, and so here we're adding these income tests that are not in the law, but the administration is trying to place those obstacles. It's hard to tell the numbers exactly. But I think it's going to impact a large number of people in the community.
I think so too. And Ingrid, I'll bring you in here. Let's say this rule change for public charge does go into effect. As I read it, if an immigrant mother gets food stamps for her kids but not for herself, that's not officially a public charge count against her. There's just so many different pieces to this. I'm wondering how, as King County, talking with public health issues here, how do you counsel people about this who might be contacting the county?
We really acknowledge that immigration law is complicated and confusing, and that every immigration situation is individual and unique, and we urge people to seek counsel from organizations like yours.
Yeah.
So I think we have to be very careful about the information that we share.
Yeah.
An important thing, I think, also is that it's open enrollment currently right now for the Affordable Care Act. And that's prompting a lot of issues. It's notable that we've been so successful in reducing the number of uninsured in our county. In 2013, it was 16% uninsured, and we're now down to 8% and just 2% for children.
Right.
And in this open enrollment period, we're hoping, to further cut away at the number of uninsured, and this public charge rule is working against the grain of that effort. So this is another public health concern, is that public charge and the fear and concern that it's raising is going to reverse the success that we've had in King County at reducing the number of uninsured.
Right. Jorge, a legal question I want to make sure that I throw to you. I'm just trying to figure out what sort of action could be taken in a situation like this. I think about our state attorney general. He's sued the Trump administration 32 times, Bob Ferguson has. I don't know if he's going to step in or what the next step would be, how cities, counties, state, maybe an agency like yours might take a legal step here.
Sure. Well, I think right now, in this phase right now, I think the primary goal is it's still during the comment period, right? So I think there's the focus is on getting the community broadly to speak up on these issues, to make their voices heard. And so, but I think that, once the proposal, and, we hope it doesn't come to this, but we hope the administration will hear those voices from the entire country and decide to not to go back to the drawing board or to just drop this proposal completely. But if they do move forward with it, I think people will be looking at this for the reasons that I articulated earlier, which is that this is adding these rules to our immigration statutes that Congress has not approved. It's taking what they're trying to do is completely dismantle our system in a way that Congress has not intended, and that leaves a lot of room for discrimination and problematic practices. Yeah. So I think people will be looking at that, but I don't think that I want to have people feel like that's going to save the day, because we still want people to make their voices heard during this process about why this is a problematic proposal.
Ingrid, let me go back to you. I know King County has been targeted by the federal government in this whole discussion over sanctuary cities. The city of Seattle calls itself a welcoming city, facing similar challenges there. I think it's this bigger question of, can we truly call ourselves a welcoming community if this new public charge rule goes through? What do you say about that? What sort of tension does this create between local governments and the federal government?
I think as a county, we're deeply concerned. We're very proud of the fact that over half of our population growth since 2010 has been from people born outside this country, and that immigrants in our community are a rich and vibrant part of our community and contribute to our economic, cultural health and civic participation in our community. Right. So we're very proud of that heritage and are doing everything we can in the power that we have as local government to be a welcoming community, and a community where we send a strong and clear message that we all belong here.
Thank you very much for that. And Teresita, this is just this larger point of the fabric of our community, how Seattle sees itself as a city, how King County sees itself as a county, how our state looks at this too. How do you explain to people who might not be first-generation immigrants how this proposal might affect them, might affect all of us?
A simple example is immunization. So we're here in the flu season. If our messaging is that people should not come in for immunization because that might be a public charge, well, that creates a risk for everybody else, right? Someone who's not immunized, who has the flu, can basically affect your health, right. Anybody's health. And so to try and take a look at it from that one microcosm in terms of how it affects everybody else. And I also, totally agree with Ingrid in terms of how this community is vibrant and rich because of our history. I think people have a tendency to look at immigrants as being in need. And, I'm a first-generation immigrant. Most immigrant families within 1 or 2 generations are immediately able to be contributing members, if not, over-contributing to this society, to this country. And, you even take a look at the different leaders around our city, around our county, you can see immigrant presence all over the place. So for me as an immigrant, to hear people talking about us as burdens is just unconscionable.
Thank you for that. Jorge, I wanted to get your thoughts on this larger idea of the fabric of our community, how it's affected by this, how you talk to people who are not immigrants, might not be first-generation immigrants here, about why this affects them as well.
Well, I think the important thing is, as we heard, immigrants are a big component of our community. They're here. We're talking about people. I mean, this proposal is going to be impacting people who are already here. We're not talking about people coming from abroad. We're primarily talking about people who are already in the United States with regard to the proposed regulation. And so I think people need to understand that those are folks in our community that are going to, potentially drop benefits, particularly in the public health arena. I think it is the clearest example, as Teresita just mentioned, of how that can impact other people. But I think in the reality too is that sometimes I hear situations where somebody in their congregation, in their business, an employee who's here, who's contributing, and all of a sudden, they can't get their green card and they're going to have to leave, or they might be deported because they didn't have that opportunity. That hurts all kinds of ways, in many different ways, because they are part of the community. And so I think it's something that we should all be concerned about, and we hope people will be engaged in this topic, because it is a complicated one, hard to understand. But I do hope that people pay attention to it, because it has a potential to have a very negative impact.
Thank you for that. And we're going to start wrapping up here. Ingrid, I'll start with you. We are taping the show just a few weeks before wrapping up public comment on this public charge proposal. That deadline is December 10th, by the way. Is the hope to maybe modify this proposal? Is there a chance to stop it from happening? I'm trying to figure out what's next here. Just, if you could, your final thoughts on this issue as we move forward here.
This proposal represents an enormous and fundamental change in immigration policy. You're the immigration expert, Jorge, so I defer to you. But it really is a huge switch to say we're going to define public charge as someone who is likely to become primarily dependent on government subsistence, to someone who receives naming for additional government benefits, who also meets this test, income test, or who is a certain age, or, it massively widens the net of who we're saying we're going to shut out. So it's part of a larger cluster of proposals and policies that are ultimately designed to shut the door to members of our community who we value.
Yeah.
And that's just not acceptable. Yeah. And as you heard all of us say, this proposal is not only an affront to immigrants, it's an affront to all of us. Because at the end of the day, no one wants their neighbor or the kid who sits next to their child at school to not have the support, the basic food and health supports they need to survive, and to not only survive, but to thrive in this community.
Thank you for that. Teresita, some final thoughts here going forward.
So I think it's Gandhi who said, strength comes from indomitable will. And I say that because, I'm here today because I'm of the community and we provide community services. Mm-hmm. And our community has a lot of fear and feel a lot of intimidation and disdain and disregard for who they are as human beings. And so I will just have to underscore, we have to maintain and keep that indomitable will, because this is not a good thing. This is terrible in terms of what is happening, looking at immigrants in sweeping generalizations that we are a drain on this society when, as I've said repeatedly, we are a net positive add to this country. And this country has become what it is because of immigrants' backs. Okay. And so to all those who are afraid, to all those who are in fear, if you do not feel you can make a comment, tell your friends to make comments. Tell your friends' friends. Say anybody who support immigrants, please make the comments that Jorge is referring to. You can also go to protectingimmigrantfamilies.org. They have a lot of information on this issue, and definitely a link to make comments.
Thank you very much. Jorge, I should point out that you are speaking November 19th at an event with the Asian Counseling and Referral Service, that's ACRS, at 5:30 at their location on MLK Way South. I'll give you the last word, please, briefly.
Well, I think the most important thing right now is, for people to stay engaged, to understand this impact, for the community members who might be impacted directly by this. I think our message is, to get, individualized advice, to not make rash decisions about, dropping benefits that are important for them or their families. And so we want people to continue to be engaged about this topic as much as possible. And there's a lot of resources in the community to get information.
There are indeed. Thank you all for your input here. And I should point out, if you'd like more information, want to make your voice heard on this, make sure you check out the City of Seattle's Office of Immigrant and Refugee Affairs website. The address is on your screen. We'll be right back.
I know we have to draw the line somewhere, but I just feel like we have to help people.
There's so many people in this country already who are struggling.
I think a test is a good idea, but it would have to be done right.
I don't think it's fair.
We'd like to know what you think. Send us an email at contact@seattlechannel.org or find us on Facebook and Twitter and give us your feedback. Before we close today, it's time for our weekly CIO poll. Do you support the public charge rule change? Yes, no, or are you undecided? We want to know what you think. Cast your vote and send us your comments at our website, seattlechannel.org/CityInsideOut. While you're there, you can watch our programs online anytime. Coming up next time, Seattle's traffic troubles. The Alaskan Way Viaduct will close permanently this coming January. Buses will stop using the downtown transit tunnel in March. How will we survive a 5-year commuting nightmare? Bracing for what's being called the period of maximum constraint. Next time on City Inside Out. I hope you join us.